Hi, everyone. Thanks for joining us. Always wonderful to have you here. If you're a first-time listener, welcome. I hope this gives you everything you're looking for. If you've been here before, it probably is giving you what you're looking for, and that's why you're back. So welcome. So glad to have you here and very glad to have my guest today. Hailing from Washington, D.C., we have Dr. Nadia Alsamadi. Let me tell you a little bit about Dr. Alsamadi. They are a queer and non-binary Palestinian-American clinical psychologist, educator, and speaker, as I mentioned, in the Washington, D.C. area. Dr. Alsamadi is the founder of Beyond the Binary Psychotherapy and Consulting, PLLC, where they collaborate with LGBTQ plus and Arab, Swana, BIPOC, and first, second generation immigrant clients to explore issues related to anxiety, identity, culture, oppression, and empowerment. That's that is amazing. That's wonderful. As a dynamic and engaging speaker, they build relationships with individuals and organizations to deepen cultural humility, critical consciousness, and compassion for the complexity of the human experience. Thank you so much for being here, Dr. Alsamadi. Great to have you.
Thank you so much for having me.
So, there from your bio and from what I understand about you, there were several things that we could have talked about. You have several areas that were of interest to me. And so maybe we'll have to do more than one of these. If it turns out to be a good experience for you, maybe you'll come back. That would be good.
I'd love that.
That would be great. I love to have repeat guests because I think a lot of our guests have a depth of experience. And each time they come back, it just gets a little bit richer. So today, we are going to be talking about that initial consultation call, folks, and how crucial that is. Right now, we are post pandemic, not a newsflash. During the pandemic, clients were kind of falling out of the trees and they were having a hard time getting in somewhere. That's not the case as much anymore. And so being able to handle your client experience, which is what we're calling it right now in our practice, from the client journey, from the first call all the way through till they're done. We want to make sure everything that happens along the way is a great experience for them. And guess what? Makes them more likely to want to work with us, to refer people to us, and to tell people that we can do well by them. So I'm thrilled to have us have this conversation today because I think it's a really unique conversation that we haven't had before. So tell us about why that initial consultation call is so critical and that how it sets things up in that client provider relationship.
Yeah, absolutely. And like you kind of mentioned in my bio, the population that I'm working with might have a harder time finding a therapist that they feel like is a good fit. And so
Yep.
these consultation calls are really crucial for them to get to kind of test the waters and really see, are you kind of matching what you're saying in your profile? I think something that might be really common right now is there are a lot of buzzwords. Folks are kind of like checking off a lot of different specialties, and then when folks are kind of getting in the room with them, there might not be as much alignment as they were hoping. And so these calls are really a way for potential clients to say, okay, like, do I want to give this person a shot and trust them with at least a little bit of my story? And the call really sets the tone for your work together. Even if a client decides to schedule an initial appointment with you, if they're not feeling comfortable in the consultation call, if they're not feeling heard or assured, this will have an impact on the intake, right? They might come in a little bit more hesitant. They might have some more, self-protection kind of present than they would if they were like, okay, you know what? I know this person actually is the right fit and they're really going to help me.
That's such a good point, and you're spot on about these buzzwords, boy. Everybody, not everybody. I don't want to have too much hyperbole. Well, I do want to have hyperbole, but I'm not going to. But people just check off. Oh, I see. They see pretty much everybody, right? We want people to think I'm the person for you, but that doesn't actually engender trust, right? And so some people can feel like it was a huge bait and switch, especially people who come from more marginalized communities where they might be really afraid to begin with for good reason. Who can they trust? So, how do you handle that when someone makes that initial call? What are you really looking for? What are those key objectives in that first call?
Well, I think something that's really important is to remember that while we are business people as therapists, Really the point of this call is to make sure that the caller is getting connected with the care that best suits their needs. So that I always think that is like the number one objective. We want to provide psychoeducation. We want folks to feel empowered in the decision that they're making, and I think that's my number one point of these calls. Obviously, the other objective is to figure out if you are a good fit for them. So you want to be able to know how to ask questions to figure out, okay, do I have the skill set? Do I have the training? Or do I have the willingness to make sure that I can meet all of these needs? And I think it's also really important to remember that, like, if you decide that you are not the best fit, that we don't want to leave folks hanging, that we want to give them other referrals. We want to give them resources outside of our practice. And every conversation that you have with someone, you're representing your brand. So even if you decide not to continue working with someone because they had a positive experience with you on the call, they might recommend you to someone else who might be a better fit.
Exactly. So that's really been our policy. If someone calls and we can't accommodate them for whatever reason, it's our access team's job to give some other options. Take a minute, do a little research. They have a resource guide, look it up, right? That is part of the brand is taking care of people. That's what we're about. So it sounds like that's what you're talking about with this too. So I bet you a lot of folks feel like they know how to do this. They know how to do this initial conversation. I'm assuming since we are having this conversation that you're assuming perhaps they do not. They think they know, but maybe they don't know what they don't know. So, how would they know if they don't know?
Yeah, that's a great question. I think from, like, the feedback that I have gotten from the clients that I worked with, the people in my life, from my own personal experience trying to find a therapist, everyone has their own style, but I think there are a few key elements that you wanna have within a consultation call, and I think the first one is just having a structure or a flow so that what you're walking into, you know what you wanna make sure to cover, you know your style, you know how to describe yourself and your services and how you work. And I think that that's a really important element. So I like to structure my calls into like 5 steps. And most folks tend to stay around 15 or 20 minutes. And I think by knowing clearly where you are in those steps, it really supports you in protecting your time and protecting the client's time in those calls.
Absolutely. So, I used to do all of the intake, back in the beginning of the practice. I did all of the intake. And I remember getting on the phone with people, and my gosh, somebody finally gets a hold of somebody and they want to talk. They want to tell their story. They have something to say. And that
Hmm.
can go on for 15, 20 minutes, half an hour or
Sure.
more. Oh my gosh. And especially if you're a practice where you might be getting the call, but you're not going to see the client, how this initial consultation is handled really sensitively, like telling the person up front, this is I may or may not be your clinician, or I am a staff member of this practice, or yes, I might be able to work with you, or I'm going to take this information, but I'm going to make sure you get matched with the best person in our practice. So being really deliberate seems important. So what are your five, you break it down into 5 steps. You said what are your five?
Yeah, so the first step is really just greeting the client and setting an agenda for your call. So, checking in, is this still a good time for this consultation? Reminding them who you are, what your practice is. A lot of folks send a bunch of outreach because they might not actually even really expect some responses. I've just heard of folks sending out, psychology today messages and never hearing back. And so just reminding folks who you are is important, and then letting them know what the call will look like. Even before I do that, I always like to check in how folks are feeling physically, how they're feeling mentally, because these calls can be they can feel a little awkward. They can feel anxiety provoking. They're calling someone up that they don't know and being expected to sort of tell them oftentimes painful or distressing and personal things about their life to say, hey, do we want to work together? So I think that check in can really diffuse some of that pressure, and asking, have you ever done this before? Just kind of getting a little bit of a temperature check and seeing where they are. And then letting them know what to expect, right? So we're going to talk for about 15 minutes. The purpose of our conversation is to learn a little bit about each other and decide if we'd like to begin working together. we're going to discuss logistics, and then we'll talk about a little bit about what's bringing you in. And then our call can end one of three ways, right? So you might decide you might like to work with me and we can schedule an initial appointment. You might decide that you'd like to take a little bit more time and, explore some other options, then let me know. Or you might decide that my practice doesn't fit your needs and that you'd like some additional referrals. And just reminding them that ultimately the goal is to connect them with the care that's best for them, even if that's not with you. So I think that really gives them back the autonomy and the power in the conversation as well. So
Yeah.
that's my first step. I know that was a lot.
No, that's great. I love that. So that was that's your first step? Or
That's my
that
first step. Yeah.
okay. All right.
Just the
So
goal setting, the greeting and the agenda setting. Yeah.
got it. Okay, but there are others because you said 5. Okay, so what
Definitely.
happens
Yeah.
next?
So next, I think it's really important. I made this mistake when I was first starting out in just kind of like jumping in, like what's bringing you in? Like tell me about why you want to come see me. But I think then we get to the end of the call, and then I find out, oh well, actually they thought that I accept insurance when I'm a self pay practice, or they need evening hours and I've only got a 10 a.m. slot available. So I've learned that you've got to determine the administrative fit, which is my second step first. So I always start with asking about, what they know about my fee structure. Do they check out the website? Does the fee feel affordable for them, workable for them? Do they have out of network insurance benefits? Do they know what that is? And I think this is a really great time to do some of that psychoeducation. And I think another purpose of these calls really is to increase healthcare and insurance literacy for folks, because I've had folks who didn't know about their insurance benefits, and that if they were able to make those payments upfront, that they could actually get reimbursed a big chunk of it. And so I think that's a really important part of these conversations too. And then if the fee works, then I ask about scheduling, right? Like, this is what I have available. Does that align with you? I have biweekly, I have weekly. And so once you can get those administrative pieces fixed in, then you can kind of really see, okay, how do we move forward with this call?
That's so smart. I love the idea of insurance literacy, healthcare literacy, but insurance literacy. Right? How many people actually know? They know they have insurance. They think everybody's going to take their insurance. You know, I think educating people about that is great. All right. So you start off with just kind of a temperature check, just helping them get comfortable. Then you do the administrative piece. You don't let them just jump in and say, so how can I help? Right, which is what a lot of folks will do. And you're going to waste
Right.
a lot of time, folks. And this is a business podcast. So, I mean, we want to be as compassionate as we can, but that's not really great for the client either if we have allowed them to tell us their whole story, and then it's really not going to work because we don't accept their insurance or our schedules don't match up. So that's I think the more humane way to go. So that's great. So that's step 2. What is step
Right.
3?
Right. So then we want to determine our clinical fit. So asking, this is where we get to ask, okay, what's bringing you in? Why are you seeking therapy right now? And then, each practitioner can really tailor the types of questions that they'd like to ask based on what the client is sharing and like what their clinical expertise is. I think this is also a time to really ask about risk as well, so you can provide resources and really understand if your setting will meet the client's needs depending on what they're experiencing risk wise. So I think that's really important to ask. And as you're talking with folks, just because, again, this is an initial call and you're not even sure if you're going to continue with them, asking permission is a really important thing. If you, after they're sharing something, right? Like, I think that's something we may naturally do, but just checking in, you just shared this. Can I ask you a little more about that on this call? And I think, again, that gives them some autonomy and safety to really decide, what do I want to divulge to this person based on the way they've kind of been interacting with me up to this point.
Love that. So when you talk about you're going to ask them about risk, how do you frame that? Because some clinicians will say, if if someone has had any kind of suicidal ideation within the last 5 years, I don't want to work with them. We're therapists. How does that work?
Right.
So how do you ask it in a compassionate way, and how do you respond?
Absolutely. So I like to say something along the lines of, something I like to check in with everyone I speak to about is their safety. And considering what you're experiencing, it's really normal to have thoughts of suicide or thoughts of self harm. You've got a lot going on, there's a lot happening in the world. And I'm wondering if you feel comfortable sharing if this has come up for you with me now on this call. And so just something like that, like really normalizing and
Mhm.
acknowledging that is something that comes up for a lot of folks. That's why a lot of folks seek therapy, and that's okay if they share that. It's just really about that information is to help us better prepare to support them or direct them towards the most appropriate care.
And how would you respond if they said, "Yes, I have had suicidal thoughts, or I made an attempt, or I was hospitalized"? How do you
Yeah.
respond to that?
Yeah, I think, like you said, compassionately responding is really, really important because I think a big fear that maybe a lot of folks who have had those experiences have is being told that they're too much or having that reaction like, okay, you know what, like this, I don't know if I feel comfortable supporting someone who has had that history or maybe has active suicidal ideation. And I think that's something we kind of have to reckon with in our field and definitely not something that we want to give off to the clients that are calling us and being vulnerable with us. So I think it really depends. We want to ask some more questions to kind of understand where they're at right now to best support them. But again, thanking them if there aren't any current thoughts, there's no current risk to their safety, like just honoring and acknowledging that part of their history that they felt comfortable sharing with you.
Yeah, 100%. I'm always a little baffled, and I get it. People are afraid of suicidality. All of us are therapists. We get it. Okay. But I'm a little baffled by folks who say, "I just will not work with anyone who has had any kind of suicidal ideation within the last year, 6 months, whatever." I mean, anyway, so I love that you address that with them, and you address it compassionately, and it's kind of embedded in the middle of your conversation. So that was that number 3?
Number 3, yeah, yeah, so
Okay,
they've gotten to
so
know you, they've gotten to hear your style a little bit, and then they get to make a choice. Not everyone might feel comfortable sharing honestly with you, and then
yeah,
you find out later kind of what's going on, and that's totally normal and totally fine, but at least they know that you are thinking about those things and caring
right.
about those pieces as well. But yes, that's step 3, and then step 4, I think naturally once they're sharing a little bit about themselves, then you can open up the conversation for them to ask you questions. So this is where we get to answer the client questions. And I always like to ask them first, do you have any specific questions for me? Some folks come in and they know exactly what they want to know from me. And some folks are like, I don't know. I don't really know what to ask you. Like, what do people typically ask you? So I think it's important to be prepared on both ends. If they don't know what to ask you, I wouldn't just like end the call and say, okay, well, that's okay, great, no questions.
Yeah, thanks.
Give them
Bye.
some examples. So I typically get asked about myself, my identities, the what it feels like in session with me. If I've had some folks who have maybe had experience with therapy might ask you about a specific modality. They might say like, "Oh, my last therapist wasn't very engaged. They didn't really say much while I was talking and I felt like I wanted some more feedback," right? So you can kind of guide them in that way and share some questions that you've gotten before, and that might ignite some new questions from them. But like I said, some folks come in like very prepared to ask you very specific things, but I think is great.
Yeah, I always love that. If somebody knows what they need and what they want, but to your point, not everybody does. So we need to help them if they don't. So this is the opportunity for them to ask you some questions or for you to offer some information about you. And to your point, you have a lot of identities. And so people might be calling you specifically for that, and you're going to share that with them on the call. Yeah,
Absolutely. Yeah, I think that is something that I get asked about, probably the most. For me, that feels like something I wanna share on my marketing materials, to be able to reach the communities that I want to serve. So folks will often comment or ask me a little bit more about myself, and I think that's something that we're increasingly seeing, especially with, like, the next generation coming up and the way that, like, our, social media and discourse is coming out, like, people are talking about these issues. It's more present for us now. And not that it wasn't present before, but it's so much more easily accessible. These conversations are being
right.
had more openly. And so I think as therapists and psychologists, we have to really get more comfortable with folks asking us these questions. We kind of have to shift more into that interpersonal, relational lens because you're going to get asked about your identities and your political beliefs too. So it's really important to prepare for these questions. I think like we're also kind of at a point in the field where we're seeing like the transition between, I don't know if like there's like a necessarily like a generational divide, but definitely like theoretical orientation wise, how you present in the session, the things that you talk about or divulge, right? The Now there's so much more rhetoric around therapy being political and that we can't do our work without talking about these issues, which I firmly believe as well. But you might not align with someone if a therapist is not comfortable talking about any of these issues or bringing themselves or any of those things into the room, a client that wants to do that might not be a good fit for you. So we will be asked about these things.
Exactly. So recently, I had a client who I was referring out to somebody else because I've been paring back my caseload. I referred her to someone. The client called me after the first session and said, this therapist told me we can't talk about politics. And I really need to talk about what just happened in these elections. And they won't talk to me about politics. And I thought, oh my God, that just didn't even occur to me. Like, what is this person's political affiliation right now? My gosh, of course I need to be thinking about that. Just something that I had never heard before. Like, nope, I'm not going to talk to you. So knowing really clearly who are we comfortable seeing, and Nadia, I think you're right. There is a generational divide, and I'm from that generation where the client had all kinds of they could just be them, and it was not our job to intervene in that, to have an opinion about that. Our job was just to help them with whatever it was they brought in. And I think that has shifted a lot. The ethics codes are shifting. It is a different world. So we have people in our practice. Our oldest therapist is 85, and our youngest is, probably late 20s, early 30s. Huge difference in terms of how people see the work. But so you're real explicit in that initial call. And in part, you are trying to draw these people to your practice, which, of course, why not? You are a safe place to be. But you hopefully live what you're saying you're about, right? So that's that other critical piece. So being really open, including about political affiliation if someone asks, right?
Yeah, and I think it does really depend. Like, that's not to say that someone calls you up, and you owe them every piece of yourself. That's not what I'm saying. Like, everyone does have the autonomy to get to choose, what am I going to share with this potential client who, you also don't know who this person is, right? So that's not to say that we owe everyone like all of these personal details about ourselves. But it is important to kind of think about when you show up in a therapy room with a client, all of the things that you're both bringing with you and how you can talk about those visible and assumed identities in the room as well. But definitely, I think a political affiliation and those types of questions are more prevalent. And even though, I mentioned there might be a generational divide, I think that that could be part of it. But I also think that the Western Eurocentric lens that has originated and shaped our field also tells us that we can't talk about these things and we have to compartmentalize and we have to be very tight-lipped and we can't ruffle feathers, right? And so I think that really is at the heart of why there are some folks who will not talk about the systemic factors that are affecting people's lives.
Which it sounds like your whole practice is set up to address that, which maybe I could ask you about in a moment. So I want to make sure we
Sure.
get through all five, but I would love to take a moment and
Yes.
hear a little bit more about Beyond the Binary because go you, that's fabulous. So, what is step five?
Step 5 is just next steps, right? So that is the final step where you and the client really get to decide, are we a good fit for working together? And as the therapist, you've been gathering information throughout this whole call, and so you have an idea, okay, I think that this would be a good fit. And so if that is the case, then you get to, I think, ask the client how they're feeling, right? Like, now we're coming to the end of the call. I mentioned there are a couple ways which this call could end. You might want to list those again just to remind them sort of their options about how to move forward. And then, ask based on their conversation, how are you feeling? Do you have any more questions for me? How might you like to proceed? We also want to make sure that, if folks are coming in with presenting concerns that we aren't experienced or trained to work with, that we're also able to provide appropriate referrals and share that, right? Like, if someone were to come in to work with me who had a primary concern of an eating disorder, that's not something that I have specialized training in. So I would want to make sure I communicate that and get them connected with like-minded colleagues who do have experience with that. That's not to say that I don't work with folks who have brought up some eating disordered behaviors that they'd like to talk about. But if the primary presenting concern is someone looking for eating disorder treatment, I wouldn't be the best fit for them. So it's just really important to kind of explain your decision making and make sure that the person knows it's not about them. There's nothing wrong with them. It's just that I'm not the best person to serve them at this time. And so if someone's like, yeah, like I'd really like to work together, then you can schedule an appointment, set a plan of action, let them know what the next steps are, what to expect from you, and then kind of take that route. If you don't think the client is a good fit for you, if you don't think that you can meet their needs, then I think it's really important to approach that compassionately. Like we talked about earlier with like suicidality, I think a feeling people often get when someone doesn't decide that they're an appropriate fit to work together is that they're too much. So how do you make sure you assure clients like that's actually not what is going on here, but it's actually because I'm not equipped to support you, and all I want to do is make sure that you're getting adequate and humble care, and I actually can't give that, and so I want to make sure you do get that, and here's what I'm going to do to help you.
Mm, I love that. Obviously, it irks me a bit when I hear that people just won't talk to somebody if they've had suicidal thoughts. Why do you think they're calling? So, anyway, I get it. Not everybody is equipped, and that's okay too. It's just, can we be humane about it? I love this framework because it is humane and it's structured, and that's about 4 minutes per section. So you really have to be, and some will take more and some will take less, but you're setting adequate expectations for yourself and for them, which I think always creates a greater sense of safety. And folks, I don't know about you, but our access team hears with great frequency that a client will call us and they'll say, "Thank you for contacting me back. I've called 3 other places and nobody else bothered." So, I mean, what we're
Yeah,
talking about is
it's really disheartening to hear that.
right. I mean, I get it. You're busy, but please call back and say, "I'm so sorry. I'm full." That's it. Hop on Psychology Today. If you don't have time as a clinician, please just tell people, hop on Psychology Today. See if you can find somebody else. But yeah, I think, please make sure you make those phone calls back. And I love this idea, Nadia, of scheduling a time for people to talk to us first versus, you know, we just assume if they're calling us, they want to book something. Again, what just gives people the best care? And again, what is your brand as a practice? And is this part of your brand? It's just really good care. So, tell us a little bit about Beyond the Binary. I've been sitting here kind of biting my lip because I really want to hear about this. So, tell me about your practice.
Yes, yes. So beyond the binary actually came from, well, obviously, I did not come up with that phrase. It is a very common phrase used all over for a lot of different reasons. But I think when we hear it, we oftentimes think about the gender binary, which is true. Like, let's move beyond the gender binary. But I think about it more like in let's move beyond the binary of everything. Like, our world are that that is ruled by white supremacy is set up in like sets of two polar opposites, right? Good, bad, right, wrong. And they tell us, like, these are the only two options that we have in kind of anything. There's really only two options. And that's just not true, but we're socialized and conditioned to believe that. And so people actually end up feeling really confused and disconnected because it's like I'm only given these two choices, but like that's not me, right? And so my hope in my practice is that we can together like really become aware of how we've been socialized, like the options that we've been given, and allow ourselves to move beyond that and really get to celebrate the beauty of our uniqueness, of our cultures, of the things that move beyond the boxes that we're put in. And I think that in addition to gender identity, like that just applies to so many different pieces of who we are and what the world tries to squash and put in a box. And so that's really what the name came from, and that's a lot of the work that I do, and I love. I really like this is my passion, and I am just really like grateful to be able to work with all the folks that I do.
Mm, amazing. And I'll tell you, name choice for a practice right now, I think is so critical. I named my practice, I don't know, 20 some years ago. And it was when trees were in, it was live oak, and the juniper center, trees were kind of big. Um, and the juniper tree is, it's, they grow in these rocks in these super inhospitable places, and they develop these incredible root structures and dig in and form amazing sculptures. And to me, they're a testament to resilience. Well, guess what? You have to dig kind of far to find that. The Juniper Center doesn't communicate that to people, and quite often they'll say, "Is this the Jupiter Center?" Not the planet, it's the tree. So, but what a great name for a practice. And folks, I have talked to many people who they're in the process of trying to figure out what to name their practice. And my practice actually had three different names over the years. And then 20 years ago became the Juniper Center. At first, it was my
Wow.
name and associates. Then it was the Women's Center for Psychotherapy, because that the person who was my business partner at that point, we decided on that. And then I was like, okay, that's too limiting, because we saw men too. And then finally we got to this point where it was the Juniper Center. But I love Beyond the Binary. I think it communicates right now so much that's important for people, and it's super clear what you're after. So just a really good branding, naming, exact kind of experience for your clients. They know what they're getting when they're coming to you, and it's not a planet that is really a tree. So well done. Wonderful. Well,
Hey, trees are timeless.
that's right. Trees are timeless, right? Especially those darn junipers. Boy, they hang on. So, final thoughts, Nadia.
Yeah, I think just making sure to consistently remind yourself of the value of these calls for the client and for yourself. I know we all get really busy, and it can feel like just kind of like one more moment of unpaid time, especially when you're in private practice. Like, everything everything that's not billable is unpaid, but there's a lot of unpaid work. Reminding yourself that this is an incredibly valuable conversation, for the client, for their healthcare literacy, for feeling heard, and for you in making long term connections. And so I just think that reminder can be helpful to really give your all in these calls. Like, you might be rushing from something else and feel a little bit rushed, but I think having this structure really supports you to have an effective call each time, and make it easier for yourself. Go like use the structure, have templates written up, know who your referral sources are, do that networking outside. So, you have these things ready to go after the call. You can send off your intro email, you can send off your referral list, your resource list. I think that can be really important. And then I think finally remembering that like we're in a professional community, and so we have a lot of resources at our fingertips. And I have a little guide that I made up too with this structure, so I can share with you to put in the show notes if that's okay. And then I have a list of a resource guide that I've created for folks with like crisis resources, community events and supports that I can also share. And then Therapy Access Project has a really great free guide for clients that gives them questions to ask therapists. So I think that's also a really good resource for therapists to be able to prepare for the types of questions that clients, in this kind of current landscape, might be getting ready to ask us. So I think those are some really important pieces. And if anyone's, listening to this is interested in talking more, like I would love to connect. So I can also put my contact info there as well. You can find me at my website, which is Beyond the Binary Psych, psych.com. I'm on Psych Today. Working on Inclusive Therapists is also a really great directory. I know Psych Today is kind of the main one. Most folks are on there, but Inclusive Therapists is a really amazing resource. And so I would direct folks there as well. And then I'm also on LinkedIn, and my email is floating around all those places.
Everyone who listened to us today, thanks for being here. I really appreciate all of you. Please feel free to contact me at thejunipercenter.com. I am your mental health business mentor. I look forward to having you with us next time. Be well, everyone. Bye bye.